So let's talk a little bit about this black box warning for Cytotec or Misoprostol, which is the medication that is typically used to induce labor in the third trimester. So I had a patient not too long ago who was 41 weeks and needed to be induced because she was well over a week past her due date. And she told me she did not want Cytotec because it has a black box warning. Okay, so here is the black box warning for Cytotec or Misoprostol. You can see the first line under pregnancy states, use in pregnant patients can cause birth defects, abortion, premature birth, or uterine rupture. And then the third line says, risk of uterine rupture increases with advancing gestational age and prior uterine surgery, including cesarean delivery. Okay, so let's talk about these things for really quickly. Number one, yes, Misoprostol is the medication that is used for first trimester abortions. So that is something, that's one of the reasons that this has a black box warning. So this medication is actually used in patients to decrease gastric ulcers if they are using NSAIDs. And so if a woman is pregnant, this black box warning is there to help doctors realize, okay, you can't use this particular medication in pregnant women because it can cause birth defects and abortion. This does not apply for women who are in the third trimester of pregnancy and they need their labor induced because of medical reasons or because they're past their due date. So the next part of the black box warning says premature birth. It can cause premature birth. Well, of course it can because it's used to induce labor. So if you receive this medication and you are 30 weeks pregnant or you are 18 weeks pregnant, sure, it's going to cause premature birth because that's what it's supposed to do. It causes uterine contractions. And then it says uterine rupture. So uterine rupture is when the uterus literally splits apart with the baby inside. And that, of course, is a major complication of pregnancy. Now, uterine rupture can occur in any scenario where there are strong contractions. So those could be contractions that your body is just doing on their own because you're going into spontaneous labor. That can be related to medication use, such as this medication, Misoprostol, or even Pitocin. So uterine rupture is one of those risks of pregnancy. It can happen to anyone in any circumstance. Now, it does say here on the black box warning that with Misoprostol or with Cytotec, there is an increased risk with advancing gestational age, meaning people who are getting closer to that 40-week mark or closer to their due date, and women with a prior uterine surgery. What are prior uterine surgeries? C-sections or surgeries for fibroids. Typically, we do not use this medication in patients who've had prior C-sections or patients who have had fibroids removed from their uterus because of this risk. So if you are in the third trimester and a labor induction has been recommended for you, please understand that yes, this medication has a black box warning, but it is not going to cause a birth defect in your completely formed baby in the third trimester. Birth defects occur in the first trimester. By the third trimester, you're not going to develop a new birth defect. It's not going to cause an abortion in the third trimester. All right. So if you go into labor at 30 weeks, at 36 weeks, because of this medication, your baby will be born alive. It's not going to cause your baby to die. I have had patients who had severe preeclampsia or had other medical conditions where we did need to induce labor at 32 weeks, at 34 weeks. And our option was either use Cytotec to induce this woman's labor or do a C-section. I'm grateful that we had this medication so that the woman was able to avoid surgery.